नमस्कार, मैं हूं डॉक्टर राजशंकर घोष, सीनियर एडवाइजर वैक्सीन डिलीवरी at the Bill and Melinda Gates Foundation. Today I have with me Mr. Akash Tripathi, who is the Secretary of Health at the Government of Madhya Pradesh. As we know, Madhya Pradesh had initially, during the outbreak of COVID, reported one of the largest number of cases in India. But after that, when vaccines were rolled out, Madhya Pradesh became an exemplar before every state because of the accomplishments that it has had in terms of coverage. Today, Madhya Pradesh has been able to vaccinate almost 94% of all eligible population with single dose of the vaccine and now reaching for the second dose of the vaccine. Mr. Tripathi joined the health department during one of the most critical periods when COVID was having its second wave in the state. After he joined, he led from the front and achieved a vaccination coverage in the state, which has, as I said, become an example before all the other states in the country. Today we will hear the story from Mr. Akash Tripathi himself. Welcome, sir.
Yeah, thank you. Thanks for your kind words. In fact, when I joined, it was mid-April and second wave was at its peak. And indeed, it was a very challenging and troubled time. So at that time, we were meeting with the challenge, we were treating people, we were finding beds, we were finding remdesivir and tocilizumab and whatnot, all the medicines required for the treatment. But at the same time, we had resolved that we will not let third wave happen, at least in Madhya Pradesh. And one of the major critical component for that planning was COVID vaccination.
Right.
So we designed a detailed campaign for that, and all the components of that planning were meticulously done, and then we achieved that vaccination coverage through implementation of that plan. In fact, we have been doing vaccination since last 36 years, but it was primarily involving children and pregnant women. So in COVID, our target was nearly 5.5 crores, which is a huge mammoth target.
Right.
So we first did that assessment that what is the capacity of our cold chain, how many vaccines we can store in addition to the vaccination, routine vaccination which we are doing.
Right.
So we had to strengthen our cold chain, and more cold chain centers were created. More routes were created, remapping and mapping of new routes was done, more vaccine vans were deployed, and whole system was mobilized so that we can meet the challenge of administering 5.5 crore doses to our adult population.
Madhya Pradesh mein kafi, there are tribal areas, there are areas which are difficult to access. So what was the cold chain planning for those areas?
देखिए कोल्ड चेन में there was a major challenge of HR also because our health staff was overburdened. We were meeting with the challenge of COVID. In addition to that, regular health services and regular health programs they were administering. So health staff, availability of health staff for vaccination was a challenge. So what we did, we deployed people from private sector also. We took final year students of nursing and medical also for vaccination purpose. We did extensive training of those people. For reaching out to remote areas, we extended our route maps to those areas and provided small vans for cold chain maintenance and delivery of vaccine. And we reached up to the last mile actually. In fact, we have done vaccination on the farms also. If some agricultural laborer is working in the farm, we have done vaccination at that point also.
We have some wonderful pictures from Madhya Pradesh. One of my friends, Dr. Kaushik Ghosh, he has captured some beautiful pictures. So the other thing, you have raised a very important point about HR, and very recent reports globally have shown that the cost in case of COVID vaccination is not actually on the vaccine, it's on HR. So it's very good that you could bring in the private sector and all of that, but one specific thing probably the audience would like to hear from you is how did you train them? How did you build their capacity, orient them?
I've had so many training sessions for them. We have involved other department employees and officers also, because in this vaccination it was through COVID portal. So it's for almost digital kind of a vaccination entry. So that was also a major challenge. We deployed data entry operators in contract also, in outsource also, and we have taken help of all the departments in terms of vaccine data entry operators, and we trained them separately. We organized sessions for private sector people which we have deployed. So through extensive training programs, we have trained them and then utilized them.
Very good, sir. Because, one of the things that really Madhya Pradesh stands out, and, I have been following some of the national conversation, is one state which never complained about the digital, issues. Many states who are having a lot of difficulty, but congratulations to the state and to you and your team on really taking this digital thing forward. Any other, lessons that, you would like to really tell the people?
Actually, I would like to say that we designed a campaign, a mass campaign, I would say. Extensive IC was involved and extensive involvement of our public representative. Our Chief Minister led from the front, and there's a network of crisis management groups which were evolved during the second wave of COVID. These crisis management committees are at the district level, at the block level, and at the panchayat level also. So they are essentially basically grassroots level public representatives, starting from panchayat representative up till the MP and MLAs and ministers also. So they were all involved in the program, and we designed a campaign in the form of COVID Mahabhiyan, Vaccination Mahabhiyan. So that was our tagline for that. And the first Mahabhiyan was on 21st of June. Initial, as in other states also, there was a hesitation in COVID vaccination, there were apprehensions. So these Mahabhiyans were very good in removing those hesitation, and all the public representative came forward. In fact, in first Mahabhiyan, in every vaccination site, there was one public representative who inaugurated that vaccination on that day. And in the first Mahabhiyan alone, we achieved almost 17.5 lakh vaccination in a single day. And since then, we have had almost 8 Mahabhiyans, and in every Mahabhiyan, there was more than 15 lakh vaccination, and maximum was in, I think, 4th Mahabhiyan, it was 28 lakhs. So in next coming weeks also, we'll have Mahabhiyans, and we are planning to complete 100% second dose coverage also by December end.
Wonderful, sir, wonderful. There is so many things to learn, particularly to learn, sir, that people must be at the center of the policy, planning and everything, and that your state really exemplified. The one challenge that, we will definitely have is around the, complacency, the compliance for second dose and all of that. But very good to hear that you have plans for that. What are some of the things that, you would like to carry forward from this in terms of your other health programs? Just say people's participation.
People's participation is one thing. And during the second dose coverage, we realized that there was complacence.
Right.
And since COVID cases were down only 9 or 10 cases per day, so people were really not coming forward for the second dose. Then we thought of involving the other departments, like the other services we are providing to the people. The one example I would give of ration. So our food and civil supplies department started asking at the PDS shops that if next time you come for taking ration, you will have to have second dose of vaccination. Right. So that had a huge impact. We utilized higher education and school education department. Their teachers, their professors, they told to students that you go back home and ask your parents whether they have done the second dose of vaccine or not. So that kind of mobilization involving all the departments of the state, that was a unique experiment, and it succeeded.
Wonderful, sir, wonderful. You remind me of what my public health teacher used to tell me, that incentives plus innovation is equal to impact. आपने ये जो रेशन का स्टोरी बताया, ये जो पार्टनरशिप का स्टोरी आपने बताया, that is exactly how a public health program needs to move. Any other element that you would like to highlight from the program? Because there is, there are other states who will be hearing this. There are other countries, particularly low and middle income countries.
In fact, the leadership from the top is very, very important. And I would say that our Chief Minister was very, very proactive on that. And his leadership has really mobilized all the HR and all the departments. Our district collectors, they provided the leadership. our CMHOs, our civil surgeon, our health staff was totally, they totally worked as a team. In fact, involvement of collectors ensured that all the department heads are involved in the campaign. There were zonal officers deployed who were monitoring in a vehicle. They were going to vaccination centers and they were reporting on an hourly basis. The kind of campaign we do for election, on the voting day we take hourly report of vaccination coverage. So that kind of system we evolved, designed and we implemented, and that really helped us in achieving this kind of success in vaccination.
Sir, excellent. When you are telling me this story, I remember I had in Dhanbad district of Jharkhand. So one district magistrate joined and suddenly we saw everything becoming very high, just like what you have demonstrated here. So I had gone to meet him and I asked him, how did you meet the gap? So he laughed and told me I met the gap with GAP. So I said, what is that? He said, GAP is governance, accountability, partnership. The kind of ownership, बहुत ही important है. The kind of partnership that you talked about. And I'm sure that, the audience who is hearing this will be greatly benefited from the lessons. Through you, I would really like to congratulate and wish the state the very best in all the accomplishments that it is having. And speaking to you, I've also spoken to ACS sir. This is a wonderful example that the state of Madhya Pradesh is setting before not only the other states of India but also before many other low and middle income countries. Thank you sir for your leadership. Namaskar.